Hi everyone, we're going to do a video on Chapter 26, Prescribing Medications in Pediatrics. So this chapter has a lot of importance. It's going to help build our understanding of how we prescribe medications to little ones, and more importantly, ways to help them and their parents adhere to taking this medicine. If you don't already have a good drug package on your phone or a good electronic resource for medications, I would highly encourage you to have one, because many of them have some nuances in them to help when you're prescribing pediatric medications. We've all heard of joint commissions, and they have published a National Patient Safety Goals guidelines to ensure best practices for medication prescribing in outpatient settings. And one of the key things from this guideline was the reconciliation of medicines. So in each visit, it's very important to review the medications that the patient is on, review what they're actually taking, what they may have stopped, be aware of any potential drug interactions, ask if there's any known side effects, and is the medication given the desired effect. Less than 50% of the FDA approved drugs have been specifically tested on children. That's for a variety of reasons. Hard to set up child-friendly settings to test, informed consent, questionable use of placebos with children, risk liabilities, etc. There are two other regulatory agencies that have been involved with pediatric medications. One is the Best Pharmaceuticals for Children's Act, and the other is the Pediatric Research Equity Act. Both of these acts have worked to provide better labeling of instructions on medications for children. We know that there's a wide range of dosages that could go from infants to toddlers to children based on weight, etc. So they have been very influential on helping to get more guidelines in place and labeling in place for different dosage levels. Also, there's been increased work to be able to evaluate medicines more clearly. The Pediatric Advisory Committee for the FDA recommends that there are warnings on medications that would talk about if it increases the risk of suicide, neonatal toxicities being used off-label. And then there's also safety issues with certain pharmaceutical manufacturers. 40% of all over-the-counter medications are produced in India, and are there different testing standards set up between different countries. Next, we're going to review some guidelines for prescribing medications in pediatrics, and these guidelines are in essence universal, things that you need to check for any prescription that you are writing. And first and foremost is good penmanship. Many prescriptions have been misunderstood related to the writing being ineligible. E-prescribing has helped with that tremendously. They also need to include accurate information. In the book on page 359 in box 26.1, there are guidelines for accurately writing a prescription. Review those. Some important things to remember is being concise when you're writing down the dosage, the milligrams. Important to use metric measures rather than, a teaspoon or a tablespoon or a dropper. Any abbreviations that may be confusing, to write those out. Some other general prescribing guidelines are being aware of certain body systems where medications may be metabolized, such as your renal or hepatic systems. Being aware of clinical practice guidelines, such as the first one that comes to mind is like for otitis media. And in the Blackboard site, we have several different practice guidelines that are under the resources section. Being aware of any influence of advertising. It's important to use decision support systems and always to check for interactions. When prescribing medications to little ones, you need to take into account the absorption of the medicine. With injectables, that's going to be dependent on the blood flow. If something's being swallowed, the absorption is going to be impacted by the GI tract, which could be impacted by the maturity of the GI tract, acid production, peristalsis, how the medication is being transported, what form that it's being given in. Also important to for the distribution of the weight, body weight, being aware of the nutritional status of the child for fat, protein, and any excessive fluid. Um, we know that tetracycline can impact teeth. There is certain medications, concerns about the blood-brain barrier. So those are all things to take into consideration when prescribing. Also, the maturation of the liver and the renal system. Hold on while we move forward. There is some prescribing of pharmaceuticals off-label, and that's meaning that evidence has not been supported by the FDA. FDA has not been approved for that. I would highly recommend that you not prescribe off of label. If there were opportunity that you felt you needed to prescribe off label, by all means consult pharmacology resources. Check the FDA website for warnings. This is a definite conversation that you need to have with the family or the patient, and document consent in the electronic health record, and be mindful of any contraindications. Other factors to consider would be ethical indications, family or functional issues, how the patient or the family is going to manage adherence, and then also if there are any developmental issues. So with infants, you're going to need to teach the parents the best way to administer the medication. Toddlers or preschoolers, take into consideration number of doses a day, how it's going to taste. Could you find a medication that meets the need that you only have to give once a day versus giving 3 times a day? With school children, very important to let them make choices in how and when they're going to take their medicines, and then also with adolescents having input as well. Just some numbers to remember in regards to adherence. 72 to 78% of prescriptions are actually filled. 50% or greater of pediatric patients consistently take medications for chronic illnesses. Non-adherence increases the utilization of health services, and you have to take into the account what health insurance is, how that's impacting the patient or the family's ability to pay for that medication, and if they're able to take it. Sometimes it's not just as easy as finding the medicine and prescribing it. On page 362, table 26.1, there is a list of factors that influence adherence and some interventions that you might consider to improve that. I encourage you to look at that table. We'll just go through the rest of these quickly. When asking about adherence, make non-judgmental questions. Ask non-judgmental questions. Know that teens have a higher rate of non-adherence. This is something you need to assess at every visit. Your input can definitely impact whether the patient or the family is going to be adhering to their medicine regimen. So being sure to express how important that medication is for whatever the purpose that it is. Be sure and be in tune to your own biases about different medications or different ways of treatment when you're working with ethically or socially diverse populations, and always try to tailor your education to the understanding and literacy of the patient and family. We all know that there's been overprescribing of antibiotics, and that continues to be a continuing problem, but work towards antibiotic stewardship to help address that issue. And just to be aware, there are advances in pharmacological research that are being used to maximize therapeutic efficacy. Some of the things that they are doing are trying to match the drugs on their circadian rhythm, different tissues and cells within the body. So you may be hearing more about that. I think that'll do it for this chapter. Thank you.